You doing okay?
Yeah, you gotta get those kids to pick up their toys.
I know.
Yeah,
I know.
they're
Well,
not
if
doing
you
that.
stopped giving them so many toys, we wouldn't have them.
Yeah, okay.
Dorothy?
Come on in.
How are you doing today?
Oh, I fell and I hurt my arm, so.
I'm your daughter, Cheryl.
Cheryl, how's it going?
It's good. My mom's not doing too well.
Not
Trying to
too
get some
well.
help.
Okay. Yeah, how'd you fall?
I tripped over my grandchild's bike.
Oh.
Yeah, I was going to the kitchen to make some pie. And
Yeah, Easter Sunday, huh?
Easter Sunday.
You guys had some nice plans, but
Yeah.
we'll take a look at that. See what we gotta do. Getting some gloves on here. Okay. Yeah, that's a nice little tear you got. We got some stuff for you. Gonna let you know you can just go home with it and take care of it yourself, or your daughter can help you. It should be kind of simple here.
Honey, are you listening to what the
Yeah.
nurse is saying?
Yes.
Okay, I'll show both of you guys. The doctor said just a little bit of soap and water should be good, and some bandages. Should heal up relatively quickly.
Hot
But
water, cold water.
we'll do some hot water, and then we'll also let you know a little bit about if it looks like it's getting worse, what to watch out for. Okay.
Okay.
So like I said, we're just gonna use a mild soap and water. And it's best if you can get a little basin, or you can just go right on.
Okay.
Hot water, and just kind of cleanse it.
Stings a little.
Yeah, it's gonna sting a little. You don't want to use alcohol or hydrogen peroxide, because
Okay.
soap and water should be good enough to prevent infection.
Okay.
And then you're just gonna want to rinse it off with a little damp towel. That hurt?
Oh, it's just a little.
How
Just
bad,
a
how bad
little.
does it hurt, Mom?
Oh, just a little.
Just a little? Yeah.
Like,
Don't hurt my mom.
Yeah.
Oh,
Yeah.
we'll be nice and gentle with her. And then we'll just pat it dry with a dry towel. Okay. And then we've got these bandages, and we'll send you home. We've got a couple here.
Lots of those.
Yeah. And you just put it on. Nice and easy. Okay, is this making sense to both of you?
Yeah.
And what we want is every 3 days you can change that. But if you need to change it more often, that's why we're sending you home with quite a few of these.
If she showers, is it gonna need a change?
Yeah, these aren't exactly waterproof dressings, so if she showers, she'll need to change it then, and that's actually a good time. You can just wash it off right in there. And yeah, keep an eye out on things. That's a nice little fall. Maybe you can go home and still finish up the Easter egg hunt.
Hopefully, I don't know. Those kids are rambunctious, just leaving toys around.
Yeah,
Working
yeah.
on it. Well, thank you.
Well, do you have any questions for me?
I don't think so. Do you have any questions?
Well, just managing pain, any medications like ibuprofen we could be taking.
Yeah, if, for swelling, ibuprofen is good. Well, that's how you do the bandage. So if you guys don't have any more questions for me, we'll actually have our discharge nurse come in, and she'll kind of, give you some paperwork and some educational things just to keep an eye out, in case this wound gets any worse, which I don't think it will if you're washing with soap and water like we talked about, but she'll just talk to you about things to look out for just in case, okay?
Okay, thank you for your help.
Yeah, all right, nice to meet you, Miss
Nice to meet you.
Falzalot.
Hi, Mrs. Falzalot.
Hello.
How are you today?
I'm doing okay.
Good. My name's Fallon. I'll be taking care of you today. And you're Mrs. Falzalittle?
Yes, thank
Oh, okay, good. I get it. You guys are funny. All right, so today we're going to be working on some patient education. I see you got a quick little owie there. How's it feeling?
It's feeling better.
Yeah.
It's sore, but it's okay.
And how did you get it?
My grandkids left their toys around, and I was trying to make a pie, and I fell over
Oh.
my 4-year-old grandchild's bike.
Okay, so you fell over a bike while you were making a pie?
That's correct.
We weren't making pie. We were actually outside taking a walk and tripped over the bike.
Okay, I got it. Perfect.
But I was gonna make a pie.
You were gonna make a pie. I like pie, so I think that's a good idea.
Mm-hmm.
Okay, so do you folks have any questions about your patient care, what you need to do when you get home? Do you feel comfortable taking care of yourself?
Well, I prefer you talk to, both of us, because she's just better at this stuff. I don't remember things very well.
Okay.
So, yeah, we both have to
Kind of know what
know
you're
what
doing.
we're doing.
Okay, so can you tell me what you know that you need to do so far?
I need to, I believe he said soap and water and pat it dry
Mhm.
and try and clean it every day.
3 days.
Oh, every 3 days, okay.
All right, well that's good. That's a good start. So yes, absolutely. So when you're removing your bandage, it kind of helps if you get the edge of your bandage a little moist first, so it doesn't hurt as bad when you pull it off. And then the other thing you want to make sure you're doing is if your skin tear opens this way, if her skin tear opens this way, you need to make sure you're not pulling the bandage with that skin tear. Pull it against it. That'll help kind of allow it to heal better. So the other thing that we need to remember is that we're cleaning it every 3 days. If you need to change the bandage more, that's fine. But soap and water is definitely the way to go. The other thing that I'm just thinking we need to talk about is the fall risk. So do you have cords or like clear paths so that you're not tripping over cords inside your home?
I try, but I could be better about making sure my paths are clear.
Maybe that's something Mrs. Falls a Little can do for us. She can kind of help clear up paths for mom and make sure that she can get moved around okay and feel comfortable in the environment she's in. And what would you identify as the worst fall risk in your home if you had to think about it, Mrs. Falls a Little?
My grandchildren.
Your grandchildren. Okay, so we need to make sure that grandchildren are aware.
We'll just get rid of them.
That grandma's around. Okay, just throw them out. I like that. You know, sometimes if anybody wants my kids, they can have them. Okay.
She just has to learn how to, tell her kids no.
Yeah.
Okay,
Oh,
right.
okay.
I'll work on that.
Well, that's very interesting. I think that's a smart point. So let's just make sure that we are clearing the area of any fall hazards as far as that goes. Cords, rugs are a big one. A lot of people don't realize that. Those area rugs are going to cause a lot of accidents, so please make sure of that. And then the other thing we can do is we can get some slippers with little rubber grips on the bottom.
She doesn't like
also.
those. She always takes them off.
Okay, so Miss Falls a Lot, why don't you like those rubber socks?
They make me itch.
They make you itch. Okay, so do you think if we found something else that didn't make you itch, we could wear those to compromise so you don't have another fall? Because we definitely don't want what happened here to be a bigger issue later on, right?
Yeah, I think so.
Yeah, so maybe we can compromise and find something that you can wear that'll work in the house. And is there anything you have concerns or questions about?
Just she picks at her arm a lot, so I'm a little worried that when I'm not around, at work, she might forget that she's not supposed to touch it.
Okay, yeah, so that's definitely gonna pose some concerns. Is there anybody else that can stay with Mrs. Falls a Lot while she's...
We don't have that set up right now, no.
Okay, absolutely. Maybe I can get you guys in contact with a few of our caseworkers to help out with just quick check-ins, maybe Meals for Wheels, whatever else she needs to help kind of lighten the load at home. Let's see, is there any other questions that you have for me?
So what do we need to look out for if it's not healing right?
Absolutely, that's a great question. So what we're going to be looking for is signs of infection, which are going to be redness, heat, if you have pain or swelling, those are obvious signs of infection, and that would definitely be a good idea to follow up with the wound care nurse or facility. They'll definitely help out with that. Any other concerns that you have at the moment?
Did you get that?
Just the bill.
Okay, yep, the bill's always concerning, but we'll try to do our best with that. She does have insurance through Medicaid and Medicare, is that correct?
Yes.
Okay, perfect. Usually they can help out a lot with that. So if there's no other questions at this time, I will go ahead and hand you guys the discharge papers and you're all set to go.
Thank you so much.
Thank you, Mrs. Falls a Lot. You're such a pleasure to work with.
Thanks.
Thank you, Mrs. Falls a Little. Have a great day.
You too.